evening. Thank you for tuning to Talk to Your Doctor show. We are coming live from TENRI Children's Hospital, Majimbo. And today we are talking about orthodontics or teeth alignment. So you can ask all the questions that you have to Dr. Wameno. He is here with us. And he'll be answering all the questions that you have today about teeth alignment. If you have any problem, any question about dental, we'll be asking all the questions live. So, Dr. Karibu sana to the show.
Thank you so much.
You can say hi to the viewers and introduce yourself.
Hi to my viewers. My name is Naftali Gitonga. I'm a dental practitioner here at TENRI Group of Hospitals. I'm glad to have you.
Okay, nice one. So you told me we talk about orthodontics.
Yes.
And maybe people do not know what is orthodontics.
Yes.
So maybe you can tell us what is orthodontics.
Orthodontist is a specialty in dentistry that deals with alignment of teeth and normally positioned the jaws and even the face. So the aim of orthodontics is to align the teeth and the jaw. Yeah.
Okay, so that means the dentist is teeth alignment.
Yeah, it's about teeth alignment.
Okay, now, and who is an orthodontist? Because when I was doing my research, I saw there is someone by the name orthodontist. Yes. And I understand you are a dental practitioner, so there's someone else called orthodontist. Who is an orthodontist? An
orthodontist is a consultant or a specialist who has gone back to school again for training in the field of orthodontist, which is about now aligning the teeth and everything that deals with the jaws and any abnormalities that may make the positioning of the teeth, the jaw, and the face look a bit abnormal.
Okay. Yes. And then from orthodontics, I understand there is maxillofacial surgeon.
Yeah.
Yes.
Those are two different specialists. Maxillofacial surgeon is also a dentist who has gone back to school to study surgery, majorly on the head and neck. Any abnormality or any diseases of the head and neck region normally are referred to maxillofacial surgeon.
Yeah.
Yes.
And teeth problems,
teeth problems, alignment, that is for the dentist. Fillings and other like extractions, general dentistry is for now has. Yes.
Okay, nice one. So we go back to orthodontics.
Yes.
In other name, people know it as braces.
Yes.
Because when we were young, we used to see people with braces and they're like, oh, someone has something that is shining on their teeth.
Yes.
That it looks like it's fun having it.
Yes.
And they didn't know it was a problem. It's not someone's wish to have the braces.
Yeah.
So what are the common misalignment?
The common misalignment we have in dental cases, they emanate from abnormal positioning of the teeth, like I've said, the jaw and the face. And most of the common you will find in our patients who come for treatment, like crowding of teeth, which is more common on the upper jaw, affecting mostly the permanent canines, which erupt a bit late after shedding of the milk teeth. We have open bite, where a patient cannot be able to, or the teeth edges cannot be able to touch one another, which occur mostly on front teeth. Though rarely you find them on posterior teeth. The teeth are not able to touch one another, which means it will affect how they feed. They can't cut because the front teeth are used to cut the food. Yes. We have also crossbite. Crossbite, in other name they are called scissor bite. Because of the the nature of how the teeth bite. Instead of the hinge coming straight to the occlusal, let me use the model. This is how the teeth should come together. For the case of crossbite, they don't bite exactly hinge to hinge. They go. Yes, some goes out, the others inside, like the scissors. They slide instead of coming together. That's another abnormality. We also have spacing. People may think having spacing is also normal. Spacing is also a kind of abnormality. You should not be having spaces. They should also be having tight contact to allow you to feed well. Also, the appearance will also look good when the teeth are in close contact. We also have overjet, where increased overjet, where the front upper teeth, these are the front upper teeth, when they come into contact with the lower ones, instead of coming closer to the lower anteriors, you find them more protruded towards outside like this. That is an overjet, an increased overjet. And that one is also an abnormality. We also a case of where instead of a reversed now overjet, instead of the upper teeth, front teeth coming in front, we have these ones coming in front, the lower ones. They are coming more in front of the anterior of the upper jaw. These make the patient also not feel comfortable, and they may have an ugly sight. So those are the most common. We also have the cases where I've said about the crowding of teeth and abnormal positioning of the teeth. We also have cases where teeth, we have impacted teeth, the teeth that have not erupted fully, and they interfere with the positioning of the teeth that are present. For this one, we will need an X-ray to know what is causing the drifting of teeth, so that now we address the issue itself, which could be the major cause of misalignment. Yes.
So does that mean someone can have some teeth problems when they are already grown-ups?
Yes.
Because like some of the impacted teeth are growing when people are already grown-ups.
Yes.
You are 30 years old, you don't have maybe two teeth which have not yet come out. So it can happen when you are old, not when you are a child only. Yes,
this is common when you are old, because an impacted tooth is a tooth that when at a time that it is expected to have erupted, has not yet erupted, and it has taken longer, and it has not even appeared to the, or partially it has appeared to the mouth, and that is the one we classify as impacted teeth. Most common is the lower wisdom molars, though also canines are also common, and both the upper and the lower, though it is more common on the upper canines.
On the upper canines?
Yes.
You've also talked about crowding, so you can elaborate what is crowding, or you didn't illustrate what crowding looks like, or why does crowding happen?
Crowding is where now, instead of having a straight line like this one, you have teeth scattered. They are not in line because of lack of space. Some are growing or wrapping on the either on the gum this side, towards the lip, or towards the palate for the upper jaw, The same on the lower side. You find teeth erupting on the towards the gum or towards the tongue on the lower side. Because most causes of this one is lack of space. Because if they had enough space, they could not have erupted. They are finding a space where to position themselves. That is why they are overcrowding. Yeah.
So there's a myth, or it's a belief people say, if we don't remove the teeth, the milk teeth early, now crowding can happen because that other teeth is still there. Then there's another teeth that wants to come out. Is that a reason why maybe someone could have crowding teeth?
No. It all depends with an individual. Because there are cases why it all depends with an individual. And there are cases where, like a child, when you bring your child to the clinic, we can be able to tell who is more at risk of having malocclusion or misalignment. And it is at that level we decide when to remove which tooth. Because ideally we don't remove milk teeth before their time, which is supposed to, the permanent one, are supposed to be replacing them. This is because there are permanent teeth that come earlier, and even parents don't even notice. They think that is a milk tooth. So to avoid those teeth, like the first permanent molar, both for the upper and lower, they are wrapped at a very early age, when the child is about 5 to 6 years. And in most cases, parents think this one is among the milk teeth. Once you interfere now with the molar, the milk tooth, molar that is bordering the first permanent molar, what will happen? Because the premolar that is supposed to replace that one is not yet fully developed. The first permanent molar will tend to drift, closing the gap. What will happen thereafter? This premolar will need that space, and already the space is being occupied by the first permanent molar that is now drifting towards that space. What keeps the teeth from not shifting from their position is that close contact with the neighboring tooth. And it is something that you observe. Once you have lost that tooth, the neighboring tooth on the posterior side, it tends to drift forward to occupy the space that has been left. Yes. So to avoid issues of misalignment later, we advise, depending with our case, when to remove the deciduous or milk teeth. We don't just remove them to make the other ones come up and position themselves. There is a way these teeth come into their position. We don't want to interfere with that. Yes.
Is there a possibility when someone is having clouding to have more teeth, more than 32 teeth? Because I've seen grown-ups whose teeth was not taken care of when they were young.
Yes.
So they look like they have a lot of teeth.
Yes.
Because there's maybe a canine, there's another one near the canine. The crowding is too much.
Yeah, crowding makes people appear like they have more teeth, but that is not usually the case. But there are scenarios where we have extra teeth, but that is not very common for the front ones. Maybe for premolars and the canine, and the molars, you find many teeth coming, extra teeth coming up, and that one will not have an issue of crowding. Crowding appears more on front teeth, and there is nothing like having extra teeth for crowding to occur. It is the appearance that make you create the impression that you have extra teeth. But once they are aligned
Yes.
in the proper positioning of the teeth, the way they are supposed to be, you won't see the extra teeth that appear in a patient with a crowding, with that case of crowding.
Okay, so when should someone now, because I know people are watching, and I'm sure someone is asking, when is the right time to take their child for the dental review, so that now they don't have problems with their teeth as they are growing up? Yeah.
So we recommend at the age of 7 years, 7 to 8 years. This is a time when now the child is shedding the milk teeth.
Yes.
And it is at this stage when they have a mixed dentation. They still have the permanent teeth, and you will find some milk teeth also present. At this time or period of time, you can be able to tell if this child may need treatment later, or if there are interventions that you can do to prevent the problem from occurring. Yeah.
So they bring at 7, 8 years.
Yes.
So if a child has some teeth misalignment,
Yes.
so when are the braces, someone able to do braces to the child? At the age of 8?
Yes, we can start at the age of 8, but this one is not for the fixed braces. We can start by doing the palate expanders. This is in case the space appears to be smaller for the teeth, and the crowding now has started to occur or to appear for that child. We can do spacing or expanding of the palate, where we do appliances, orthodontic appliances that we do in our dental lab, to make the jaw, the upper jaw expand to accommodate the teeth that appear extra, because that's what you said about crowding.
Yes.
So that it is the space that they are lacking. That is what is making them appear crowded. So once you expand the palate, or even the lower jaw,
so you are able to expand it?
Yes, we are able to expand, because at that age, when the child is growing, their jaw is easy to manipulate.
Yeah.
It's very easy to manipulate, and it's very easy to create that extra space. And this one now will save the child from having a tooth removed, because for adults we can't expand the jaw. That's when now we opt to remove an extra tooth. We sacrifice most a premolar, both on the same side, to create more space. But once we do this one for a child, there will be no need of removing a tooth to create a space.
Okay.
Yes.
Okay, nice one.
Thank
So how can one tell that they need orthodontic treatment? Because maybe someone can say it's a family thing, our teeth look like this. So when can someone tell that they need the treatment for orthodontic?
Orthodontic treatment depends on that individual, because there are people who are comfortable with their appearance, and they don't feel intimidated with the way they look. But everybody needs orthodontic review to be advised on whether they have a good alignment of their teeth, because there are benefits for doing that. Yes.
Okay, nice one. And what are the treatment options? This thing called bad bite. What is bad bite?
Bad bite is the opposite of a good bite. And this is a good bite. A good bite where the teeth, you can see they are in line, they are not straining when the patient is biting. That's a good bite. Now, the opposite of that, which is a bad bite, is where you have those features I've talked about, like crowding, teeth more, protruded more, spacing. Those are bad bite.
Yeah.
Yeah.
Okay, from there, we go to maybe the benefits. What are the benefits of this treatment?
The benefit of treatment,
Yeah,
orthodontic treatment,
yes.
are many. First, let me start by saying that the self-esteem, is very important, for especially for those people who meet a lot of people, and they want to express themselves. They have a task.
Yeah.
They need to appear in person, and it affects more children, because like I normally tell patients, children are very honest.
Yeah.
They can't hide their opinion
Yeah,
about
sure.
someone.
Yeah.
If they see your teeth are not aligned, or they are protruded, they associate it with some funny things or animals, and they will maybe nickname a child depending with their appearance.
Yes.
And this may affect their performance because of even that low self-esteem.
Sure.
So for self-esteem is one benefit you get from orthodontic treatment. We also realize when the teeth are straight,
Yeah.
they are easier to clean, which means now you'll be able to brush your teeth properly without having difficulties.
Yeah.
That one is a benefit. You also have lower risk of developing cavities,
Yeah.
because you are able to brush all the areas, and the gum disease. Yeah. So also feeding, the function of your mouth also is about feeding. You'll be able to feed well, because once the teeth can have a good bite, they will be able to crush and chew the food. Also the speech. There are some ones that tend to disappear or to miss when you don't have a certain bite, which is the correct bite.
Yeah.
Like for the case of open bite, you find there are some sounds you need to pronounce when your mouth is closed, fully closed, but you can't close
Yeah.
because of the open bite. So you will not be able to pronounce some words. So for this one, we'll also correct that one. Also, it makes you appear beautiful. When the opposite of being ugly is beautiful.
Yes.
Yes, because people with a bad bite, they look ugly. But once you correct, they will feel comfortable with their look. Yeah, those are some of the benefits.
Yeah.
Yes.
Like maybe when someone doesn't have a front teeth, cannot be able to say sasa.
Yes, sure.
And it's a
Yes, exactly, exactly.
Okay.
You means, yeah.
So those are some of the benefits of having the orthodontic treatment.
Yes.
And from which age is someone supposed to come maybe for the orthodontic treatment? Is there a range maybe from 1 year to 20, or even the old people can come for, maybe someone is 40, maybe they're feeling they're still not confident. Is it possible for them to come for orthodontic treatment?
Yeah, let me repeat once again about bringing your child at least from the age of 7 to 8 years. That is for us to assess whether they need orthodontic treatment, or if there are interventions we can do to prevent the problem from occurring in future. But now for those who may have the problem already and they may need treatment, anybody can have treatment, orthodontic treatment, and align their teeth. But the problem will depend. Now the problem also will depend with their age. First is the hinge and the kiss, because like now for a child who is between 12 to 19 years, they take some take an year or lesser to have their occlusion corrected or the alignment corrected. 400 above that age, they may take even 2 years or more. So the more the age, the longer the time it may take to align the tail.
Yeah.
But everybody can have the treatment.
The treatment for
Yes,
orthodontic.
for the orthodontic
Now,
treatment.
after now looking at the benefits,
Yes.
now what are the risks of these orthodontic treatments?
The risk of orthodontic treatment now comes with problems, gum problems, especially when now you have appliances in your mouth that may prevent you from reaching some areas when brushing. In our setup, we teach patients how to brush their teeth after placing the braces and the other orthodontic appliances. And we also provide orthodontic brushes that will be able to brush areas that cannot be reached by the regular brush. So orthodontic treatment can cause someone to have gum disease, even bad smell, and sometimes dental cavities if you are not brushing well. But if you look at the benefit, they outweigh the risk. What you need to know is to have the knowledge of what to do to avoid yourself from finding yourself from getting those diseases that are associated with appliances.
So are you offering the dental department offering these orthodontic services?
Yeah, we do offer orthodontic services for a child from 7 years and above. Yes, we are doing that one, and we book them for such cases. But this is after first examining and taking radiographs where necessary and study models for us to plan the treatment. Yes.
So maybe people would like to see what does someone, the braces maybe, or the orthodontic treatment looks like. Maybe on an illustration, like showing them this is how it happens, this is how it looks like. Yes.
I have just one for the traditional braces, metallic ones, where we have the wires, the brackets, and the bands, the rubber bands that holds together the wire and the bracket. This is how an orthodontic braces look like. But we also have clear orthodontic braces for those who are concerned about the appearance. They may not like having metal on their teeth. There are some. We have clear orthodontic brackets and or appliances that can be used to align the teeth. Yeah.
So what is the difference between the metallic one and the clear one?
The clear one will not. It will not be easy to say that, or to know that someone has braces. Yeah. And before I go to that one, there is also another one. Instead of having now the metals and the wire and the bracket, you have custom-made trays that also they are colorless, which means they will reflect the color of your teeth instead of you are seeing the appliance, but they are also part of treatment options we have. though those are not common for one reason. They need a lot of time.
Yeah.
They need your presence also, your a lot of frequent visit, because you need to wear them 1 to 2 weeks, which means you'll be regularly coming for them, because you have a series of them. Yes.
So
This is the most common.
yeah. I've seen so many people with this.
Yes.
So for how long do you stay with the braces for your teeth to be aligned really well?
Yeah, like I said, this one will vary. Will vary depending on the individual. But for teenagers, because that is where we have rapid growth, from the age of 12 to 19 years, they take less time. In a year time, if they follow the instructions and the appointment that they have been given, it is very possible to have teeth aligned in less than a year. It also depends with the kids. There are kids that take longer to align than the other. Yeah, there are kids that take, like now, if we are combining a case where the teeth are not aligned, and we also have an open bite. We are doing, we are trying to align the teeth, and still trying to close the gap, the open bite. So it can't be the same as the one we are just doing alignment. This one may take even longer. Yeah. So and for adults, they take longer. That's why I've seen from the age of 12 to 19 years, they take lesser time. For adults, the bone have grown. We don't expect much of growth happening at that age. So now shifting and moving the teeth to the correct position may need to take some time. It may take longer, 2 years. So when you find yourself having braces for 3 years and the teeth have not aligned fully as you expected, you should not feel like this one is not working. It needs patience. This is one of the disadvantages also I forgot to talk about. Patience. Because patience also is required for this treatment to get the desired result. So patient will require a lot of patience and a lot of discipline, a lot of obedience also to instructions for you to achieve the outcome you wish to have. Yes.
For the first time of someone having braces,
yes.
Is there some maybe uncomfortability where someone feels they're not able to eat when they have them, maybe the first week or the first days of having the braces?
Yeah, the first time after placing the braces, the first, like, let me say, like 2 weeks to 1 month, you may experience some discomfort. At the times, you may need some painkillers, but not to all cases. Not everybody will experience that. It all depends with a particular case. Where now, when we are putting these wires, you can imagine what they are doing to your teeth. They are exerting some pressure. You can see from here to here.
Is the machine that is used?
No.
Because they look like they are really attached to the teeth.
No, not machine. These are things that are done. We use a composite, orthodontic composite, to bond this bracket with the tooth that is attached there. Now, for this model, is showing a straight alignment. Now you can imagine if the tooth was inside, there is a lot of pressure pulling it outside, and another one from outside being pulled
inside.
Yes. Now that pressure is what causes pain. Yeah, that is the cause of pain. Though it's not
So
too
the
much
pain,
pressure.
the pain stays for how long? Maybe someone has had it today. In the next 1 month, you'll say maybe still having the pain.
After 1 month, there will be no pain. Now the teeth are trying to position themselves.
Yeah.
You also notice that immediately after fixing the braces, even the teeth themselves, they become somehow loose. They are moving. You can imagine they are changing their position from where they were.
You can feel like they want to come out.
Yes, but that is not the case. They are just realigning themselves to the position that you want them to be. So you should not be worried because of that. Those discomfort happen for a short time, but thereafter they disappear. Yeah.
Once the teeth have aligned and someone now is due to be removed the braces,
Yes.
is there any pain that someone gets, or has there been a case whereby after 3 years the teeth are not yet aligned well?
Yes, there are cases, a few numbers, but these ones, most of the cases are associated with the patient himself, compliance.
Yeah.
Where if they are not complying, they are not coming for appointment when they have been asked, they are missing appointment because this is the major cause.
Yeah.
It may happen. It may happen. At times, like mentioned about the discomfort, they may feel the discomfort and try to relieve that pressure by removing the wires. So the effect that that wire was supposed to apply on those teeth is not felt, and what will happen? The teeth will stop from adjusting or shifting to the position. So for such cases, you may find people coming for treatment, but taking even longer time to align because of also compliance. They need to come for appointment. They need to report any problem in case of a bracket coming out, a wire becoming loose, or any abnormality they notice from the appliances. They should report that one as soon as possible, so that we keep the pressure. It is a gradual pressure. It's not painful. It's a gradual pressure that is consistently exerted on those teeth. Once we interfere with that process, the moment there is no pressure, there is no movement, there is no alignment that is happening.
Yes.
So that's the case. Yeah.
So when someone have the braces, when you have normal teeth, like you advise us to brush at least twice or thrice a day.
Yes.
So when you have braces, how many times are you supposed to brush your teeth?
When you have braces, you are supposed to brush as you brush normally. There's no much complication, but in between, like when you are at work here, many don't carry their brushes, and that is not a problem. After heating, you need to at least rinse with water to remove the food debris, to remove anything that might have been left. Because for any problem to occur, that food must have taken very much time to cause gum disease or decay. Brushing twice a day is not too much to ask for them. Yes, yes.
So at least morning and evening.
Morning and evening.
And people, I'm sure so many people who don't brush in the evening.
Yeah.
It's only brushing in the morning, which is very important.
And evening, yes, as you have seen, evening is the most important time to brush your teeth.
Yes,
Yes,
evening.
yes.
Kindly note, in the evening is the most important time to brush your teeth.
And
Definitely have noted this.
yes, and the reason,
Yes.
when you are sleeping, like now, we are talking, saliva secretion to enable us to produce speech is there. And a lot of activities, bacteria and activities are interfered with. And you notice once you wake in the morning, you find you don't have a good smell. Always you will have a bad smell even after brushing. But what happens after a few minutes, once you have woken up, your breath freshens. What has freshened the breath, and you have not even brushed the teeth. It is now the saliva. Now at night, saliva secretion is low because it is not much needed. So bacteria are very active because there are no interference, no movement of the tongue. Anything that interferes with the activity is not there. So if there is food debris, sugar present, they will have time to maximize on that sugar, and the result will eventually be felt by developing cavities and gum disease. Yes.
Okay, I'm not sure whether our time is over. I can see our director is almost, but we need to check on the feedback because I'm sure so many people have asked questions. I'm seeing a lot of questions coming in, and maybe we can check some of the feedbacks here. And before that, there are people who love singing, and others love, sports.
Yes.
Does braces affect, maybe someone sporting or someone singing when they have been just had braces?
Braces does affect singing, but for sport, we will see some. Not that they will affect, but they can be at risk, like rugby. Rugby is a very rough game, and when you are having braces, it's not easy to wear the mouth guard that they use to protect their teeth. So that is a scenario where braces may interfere with the sport.
Okay.
Yes.
So I can see some feedback here.
Yes.
Upper jaw replacement and removable. How much? Is someone with us?
Oh, dentures.
Yes.
They are talking about dentures.
Yes, this is a question that someone has asked.
Yeah, a complete denture replacement.
Yes.
Here we charge 15,000. Yeah, for a complete set, both upper and the lower.
Yes.
Yeah. That is for acrylic blanch, the ordinary blanch that you find people with. But we also have advanced, more advanced teeth, but still removable. They are called flexible dentures, and they have one advantage: they are not easy to break. As they want flexible means they are not easy to blend, and they blend very well with your gum. They are very light. That is the other option we have, and for that one we charge 30,000.
Okay. Parted?
No, they're full set, both up and the lower.
No.
Yes.
And that one can be maybe for the young people who have had a problem, maybe 20 years, and then maybe the teeth were affected, and maybe the old.
Yes, anybody can have. Can have. Yeah, but we can't prescribe dentures for children. Yes, unless space retainers, we can do that one.
There is babies, TENRI, who have the milk teeth as they come out. Then they have the original teeth. Then now we have a lot of problems like zikona mashimo.
Yes.
And then now, like they are very small. Like they've been eaten by the. Have you had such
Yes,
cases?
yes,
Because I've seen. So what do you do to such a child?
The permanent, you are talking about the permanent?
Yes. Permanent teeth have issues. Like it's like they have been eaten. They are remaining very small part of it.
Root, yes. Like root. They have two options. If they can afford, there is also another treatment option of replacement of teeth, where you use the existing ones as the supporting, as the post to support the teeth that are going to be replaced. That one will also fall under another specialty called implantology. the implantology, they also use the roots to support the abutment and the crown they fix to the teeth. So they use those stumps as the supporting gadget, but now they are natural. But if you can't afford that one because it's quite expensive, we extract the teeth. We extract the teeth, but and also depends the age of the child. If they are too young, we will do a denture, a removable denture, and at least to make them feel comfortable with their appearance. Because you can't imagine a child having gaps and they are not expecting another tooth to come to replace the missing one. Yes.
Okay. There's someone here by the name Purity Njero is saying, what is the age of limit for teeth alignment and how long does the teeth alignment take? I think you've answered that one.
Yes, yes.
And there's someone by the name Chris saying, nice presentation. We have someone else by the name of Rugi. Wow, very keen on this topic. I think this is one of the topics that people are very interested because of maybe their smiles gives a lot of confidence.
Sure.
And there's someone else here, Rebusen, saying, good job, Dr. Gitonga. Naomi Gare saying, good information, doc. Kimutai saying, nice presentation. Jerry saying, very educative and informative topic.
Thank you.
Pamela Wanja saying, the hospital of my choice. Sandy Johnson saying, tuned and well represented. Ngare saying, mafunzo mazuri. There's someone else saying here, Maureen, nice topic. And there's someone here asking, refill me how much?
Sorry?
Refill me how much?
Oh, filling.
Yes.
You know, client ask about filling and in the context they mean replacement. I will talk about the two.
Yeah.
Filling, you do filling to a tooth as an existing cavity. And it all depends with the extent that cavity is. For shallow cavities that has not invaded the pulp or the nerves, we do filling. And a filling will cost you roughly between 1,500 to 1,700. That is 1,500 to 1,700. If we need now to treat the nerves, that is root canal, that one will cost the patient extra amount for treating the root now, which is 4,500 for root canal, which is done in 3 sessions for posterior teeth, and also for anterior, the front teeth. We do them in 2 sessions. Yes.
Okay. Someone is asking also, for a 3-year-old with dental decay, what's the best way forward?
I can feel with that concern of that viewer, because at the age of 3 years, it's very difficult to treat a patient, that especially when you are prescribed a treatment that may require, let me say, filling or more extent. We use those gadgets to drill the tooth to remove the decayed part, and you can imagine how scary for a child it appears. But if you talk with the child nicely, there's the language you use, and we make them calm before we start the procedure. And in most cases, it is very successful. It is possible to treat a child from the age of 3 years. We can do filling, we can do the root canal of milk teeth, which we call pulpotomy.
Can be done?
Yes,
for
yes,
milk teeth?
for milk teeth.
And when the teeth is due to be removed, what do you do?
If it is due to be removed, we remove the tooth. Yes.
So if it's not due, it can still wait.
It can no. If there is any problem in the tooth,
Yes.
and it is due for extraction,
Yeah.
you do extraction. But if it has no problem, you wait.
Yeah.
Yeah. Mm.
I think we've done the longest show.
Mm.
Because I think on the dot you've a lot of
Is
information.
that, yeah, sure.
And you've given us a lot of information. I'm sure next time we'll talk about something else, because I see people are asking questions and they're asking questions here. Even someone else is asking about teeth replacement. So someone else is asking about maxillofacial, and someone is asking, do you offer all these services we've talked about today?
Yes, we offer.
Yes.
We are talking about the services we offer.
Yeah, sure.
Yeah, we offer these services. We have personnel
Yeah.
who do the services that I've just mentioned. We have also maxillofacial surgeon
Yeah.
who comes on need basis.
Yeah, sure.
Yes, he is always available. Yes.
Okay, that is nice. As we're winding up, Doc,
Yes.
there's a last statement which you need to tell the viewers. Maybe you can tell them as we're winding up in seconds, that
Yeah.
we can wind up the show.
Yeah, what I would tell my viewers is dentistry is an interesting and everybody needs this knowledge, and it is always no one is can be very sure that you don't need dental service. You may feel like your teeth are okay. You may feel like you don't have dental issues, but once you come for a checkup, you find problems that you never knew. Now, I recommend for regular checkups, at least twice in a year. Let the patient come with or without a problem for checkup, for you to have to avoid issues of having problems with your dentition later, and for your children, bring them as early as possible so that they can get accustomed to dental clinic. Wasikuje kwa clinic kwa meno, akiona daktari tu anaanza kulia, because there are many stories outside there about dentistry. There is people scare dentists. They are very scared about dentists, which is now transmitting to children. So my advice is to come for checkups, whether you have a problem or not, to know your oral health, your general health of your mouth.
Okay. So thank you, Doctor, for coming up for the show. I think people have gotten a lot of information, and we can't answer everything because now we are almost getting to 1 hour of us talking here.
Okay.
So thank you so much for coming through for the show. And everyone who has been watching this show, you can share the conversation to your friends so that people can learn more about teeth alignment, and you can visit our dental specialist or our dental technologists here at TENRI Majimbo. We have a dental clinic, we have a dental laboratory whereby we make teeth for you, for the dentures, so you can, and even the crowns, so you can come at TENRI Majimbo, even at TENRI Ena, TENRI Doctors Plaza, TENRI Mwea, and TENRI Makima. You can get these dental services anytime from morning to evening. So thank you so much for watching. It has been a pleasure having all of you for the show. I thank you. My name is Oshara. Thank you so much. Have a nice evening. Keep sharing the conversation.